How's it going, everybody? Today we're going to be scrolling through Reddit, the nursing subreddit of Reddit, and we're just going to have fun. Excuse the setup. This isn't going to be my permanent setup, but if you've been following me on my latest videos, I'm in the middle of a chaotic move and it's coming along. It's coming along. It's just still chaos. So I figured it'd be a great day to just kind of scroll through Reddit for today's video and just have a fun video. My name is Jesse. If you guys are wondering, if I didn't say that, welcome to Male Nurse Mentor. If you guys ever want to reach me, best places to reach me, Male Nurse Mentor on my Instagram page for any questions, guidance, simple questions really, and for any a little bit more elaborate, nuanced questions, send me an email at support@californiaprenursing.com. And then also check out that website. I have resources, californiaprenursing.com, for those really nuanced and elaborate questions. We could sit down together one-on-one, just work through this. We could work through this together, right? I'm here to help, honestly. So any method that works best for you, reach out anytime. All right, now I'm gonna warn you guys, right? This is Reddit, okay? If you guys are familiar with Reddit, you know what it is. If you're not, then I'm gonna show you what it is, and take it with a grain of salt, right? Let's see. So this is Reddit. Another thing is, if you want to add me on Reddit, there's some way to add me, follow me on there. It's Male Nurse Mentor. This is me right here in this corner. Little squiggly guy right here with the beanie. I'm always wearing beanies. But as you could tell just from the banner, right? Hey, 1.1 members, 1.1 million members, 264 people online. There's a lot in this here. This is the nursing Reddit. So let's just scroll through it. Stop bringing your your fake service animals to the hospital. Very disgruntled employee. I'm currently a patient on my own unit. Okay. Oh, this is funny. Look at this one. I owe her my life. The psych patient trying to bite me. 10-year Filipina nurse, and then you cling on to the Filipina nurse. Me, I've been a state worker, and there are a lot of Filipinos. I love Filipinos that work for the state. They just do it right? Like they know, hey, I'm gonna go in, knock two birds with one stone, work for the state, get a pension, be a nurse, do my thing. That's how I've had high regard for Filipino nurses. I've had a really great experience with them, working with them as co-workers. I love them. And they also take nothing from nobody, right? They don't take it. The same approach I could go with a patient. This is in prison, by the way. The same approach I take, it doesn't work. The Filipina nurse comes in, same thing, different tone, maybe just the energy behind it, and they'll get it done. They will. So this meme is actually really funny. That's all I gotta say. And all right, let's see this right here. This is the one I'm looking for. I feel burnt out. So let's dive into this. There's not much, but I feel burnt out. Feeling hat 343. Is it normal to feel burnt out as a nurse? I just hit my first year. This is too early to feel this way, right? I'm gonna let you know. Some time ago, I made a video, and it was a reel, right, on YouTube, and I think I pushed it out on my Instagram as well. The one biggest tip that I learned, and through my first 2 years, was to say no. And a lot of people didn't like that. I got a couple comments saying, what do you mean you say no as a new grad? What do you mean no one's gonna like you? The fact is, if you never learn to say no, you're gonna burn out. I imagine this person here is burning out because they're just overwhelmed. One, because it is overwhelming to be a nurse. It's very overwhelming, right? You have the life of patients in your hands. And if you work in the hospital and acute care, even more so, right? Emergency medicine isn't easy, emergency care isn't easy. Even people post-op, right? Especially as a new grad, the weight of all that is not easy. That is one component. That will always be there. No matter where you work newly as a nurse, as a new grad, that part is always very difficult, the weight of that responsibility. Nursing school doesn't teach you that, right? So it's very easy to burn out just in general because of that. The other component to this that I've seen, one of the biggest, is not being able to say no. So when management oversteps a little bit in your lane, in your life, right, towards you and your feelings, they overstep, right? Overstep their welcome. If you don't learn to say no, it's just gonna be even worse. It's gonna be even worse. Trust me, I learned all this during COVID. I almost quit being a nurse maybe 2 years into my career, right? Because like I was a new grad for a year and then COVID hit. And ever since then, like I was gonna leave. And I learned to say no because I didn't want to leave, right? I liked nursing, I liked the specialty, I liked all the work I put in to be in that field, right? To make the money, get the work-life balance, get the job stability. I wasn't just gonna give up, but I almost did when I didn't actually know how to say no to management, no to patients. And trust me, whenever you learn how to do that, it takes another weight off you, right? As opposed to putting it on you. I feel bad whenever I see new grad nurses especially feeling that burnout, right? Because it is real, especially in this career, and nursing schools just don't do enough, I feel like, to be honest with you that it's gonna suck, right? I mean, I get it, they're there to prepare you, but I'm gonna be here and be honest with you guys. The first year is gonna suck. The first 6 months, no matter where it is you work, are gonna suck. Once you learn, right, how to ride the bike of being a nurse, which takes about 6 months, right? That's not a short amount of time. Once you know how to ride this bike of being a nurse, you can then be a nurse anywhere, right? And you already feel a little bit more comfortable than that very first time you're a new grad. So just keep all this in mind. So for this person, that's my advice. Someone wrote, I'm not in year one, but I'm feeling burnt up and spit out. It's a terrible place. I hope it gets better. I mean, if you never learn to say no, it's not going to get better. It's only going to get worse throughout your entire career. And that's a big piece there. So my best advice is learn to say no and hold those boundaries firm, because this is a longevity thing, right? Don't allow yourself to be stepped on so much by management, by patients, by the weight of the responsibility, that then, you know, you get chewed up and spit out. Take care of yourselves always. All right, let's move on. What's the one lesson from nursing school or work that stuck with you for life? So, I mean, these are getting good. Let's see. Mine was from a patient who passed away holding my hand. She whispered something I'll never forget. People remember how you made them feel, not how fast you charted. What about you? A lot of people have been commenting on here. It's never routine to your patients. That's true. Just because someone is a nurse for 10 years doesn't mean they're good at caring for someone. Don't let nurses that have been in the profession longer than you bully you around. And that's another thing. There are some nurses that are not nice, and they're not going to be nice towards you. And it's unfortunate, but that is what the career does to you whenever you've just been unhappy and stepped on for so long, right? By patients, by management, you get this bitter nurse, right? And then that bitter nurse takes it out on you, the new grad nurse who's fresh, right? Who is still optimistic about the career. Just keep that in mind. I've been a nurse now for 6 years. At this point, I see my career as a longevity thing. Like, I'm very glad I've left bedside. I'll be very honest with you. And I'm glad I never worked in a hospital. Again, very honest and transparent about that. That's all I gotta say. Put yourself first. Everything else will fall into place and get the attention it deserves as long as you take care of yourself. This career will eat you up and spit you out if you let it. Literally what we're saying. Put yourself first. Know how to say no. And everything else will fall into place. It is a longevity thing. So I'm glad that person put that there. And someone underneath said, you know, I'm putting my own oxygen mask on first, especially when I have to pee before starting my next case. A nurse of 40 years told me no one's ever regretted taking a bathroom break. I mean, that alone is a pretty good one too. Always clean the vial top even when no one is looking. It ain't about the vial top. It's about doing the right thing all the time, even when you don't have eyes on you. Or in OR, we call it a sterile conscious. I heard of someone did a study that swabbed the vial tops into petri dishes and nothing grew. That's awesome. Let's kind of move through. So if the little lady who's been married for 70 years says he's not acting right, you better listen. Oh, that's good. Flexibility is the key to mental health. Told to my entire class on the first day of foundations of nursing 25 years ago. You know, if it doesn't feel right, it's probably not. I mean, intuition, your gut, makes sense. You're replaceable at work, not at home. 100%, 1,000%, infinity %. This one, I wanna jump on my soapbox for this one, and it's true. If you put your career first before your own personal life and your family, the own relationship you have with yourself, and then from there it'll trickle into the relationship you have with others that you care about, If you put your work before everything at the top, you're going to lose it all. Trust me. I mean, I've seen that. That's kind of what I've seen in my upbringing. You're right, with my parents. Never do that. And it's very common to do that. A lot of people strive for these work-related goals, and at the end of the day, they obtain that goal and they lose everything else, just slowly over time, right? Because your relationships are a foundation. You really got to nurture them. You got to build them up. You got to continue to keep eyes on them and inspect them, and then reinforce them, and then build them back up, and every once in a while remodel them. If you just neglect them for the sake of a big goal, right, like something to achieve at work, you're going to get that thing at work, and you're not going to keep everything else that mattered to you at home. I like that one. You are replaceable 100%, and you're going to feel it, especially now since the post-pandemic world, especially in the workforce. You don't even have to just be a nurse. It's any workforce. You are replaceable. 100,000, infinity%. You are replaceable, especially as a nurse. You're a dime a dozen, unfortunately. There's new grads coming out of school every year. And honestly, they're more attractive than you are. Yeah, you have experience, but they want less money. And unfortunately, right now, with the current economy, businesses want to find the cheapest labor. Hospitals are a business. They also want to find the cheapest nurses to pay, right? They'll keep a handful of those very senior nurses, and they'll piss a lot of the senior nurses off. They'll eventually leave, and they'll get a lot of these new grads that they pay less. And as long as they have that one nurse that can train the new grads, they're okay. It's just unfortunate, but that's how it is. So very good quote, very good saying here. You are replaceable at work and not at home. So find out where your priorities are always. When I was a floor RN, if a doctor goes in to discuss things with your patient, follow them. Great learning experience being a fly on the wall. That's very true, especially if it's a chill doc. Some doctors are, they'll close the door right away, but if it's an inviting doctor, and even if it's not, I'll say, find a way to get in that room, because you're hearing exactly that communication line. Some patients say, oh, the doctor told me this. You speak to the doctor says this, the patient says this, the chart says this, and you're like out of the loop. So if you can go in there when the doctor's in there with the patient, even better. Clear line of communication, and you're involved. You're hearing what the doctor communicated to the patient. That way there's nothing like that can be misunderstood. Just you're there, right? So that's a very good tip. I used to be afraid of homeless people, but now I realize they're much more likely to be victims than predators. And that's a good point, unfortunately. It's sad. Just anything with the homeless population is sad. A lot of people are frequent flyers when they're homeless, going to hospitals, and a lot of people honestly get tired of them, and I've seen it, and I've also felt it on both sides, right? Having to deal with homeless populations that are frequent flyers, and then taking the time to sit back and see it, right, for what it is. That's a good one. I like this one right here. Boundaries. That's it. Boundaries. I still get hung up on the fact that someone didn't like that tip that I gave. A couple people actually, in regards to learning how to say no. A lot of people liked it, but a few people didn't. I hope those people that didn't will eventually learn what boundaries are. Trust your gut and speak up if something doesn't feel right. If it's wet and not yours, wear gloves. So let me read this again and give you what I think my one lesson from nursing school or work that stuck with me in your life is. So for me, friends, working in a prison, right, my whole career has pretty much been in corrections, working as a jail nurse, working as a prison nurse. The one thing that's always stood out to me, eventually, like it painted this picture, and now that I've left that setting, it stood out to me, right? It is this. It's the prison, the actual incarceration is in your mind. Those patient inmates, there were moments, there were days, a lot of them, whether it was me or coworkers, that those inmates were happier in prison, incarcerated, than I was going to work and make money that day, and my coworkers going in to make money that day. And that taught me something when I would see that over and over again, right? It taught me that the real prison, the real incarceration happens in your mind. We can create our own prison, our own hell, our own incarceration in our life, and we can leave that setting. And the reality is, for a lot of people, leaving to work is their escape for the day. So what does that tell you? If your escape for the day is going to work, and for me, it was literally prison, right? For some people, it's literally prison. That is your escape. What does that say about your home life, the level of peace you have in your life, in your day-to-day, just being, right? The real incarceration, you build it. The real prison, you build it. So always be mindful, be careful what it is that you're building, what it is that you're striving for, right? Always. Because what you're after may not be what it is that you actually want when you sit in that space of wanting it, right? The cost may be too high. And if the cost is too high, reevaluate everything and realize maybe, just maybe, you already have enough. So that's the one thing I learned from working as a nurse in corrections. Anyways, friends, that's going to be it for today's video. If you guys enjoyed this is a Reddit series. I'm going to do these. I've continued to do these every once in a while. I started this series way back, but I figured with this move, with this chaos, it would be a good, easy video to get out. Anyways, friends, you guys know where to reach me. If you want to find me, get a hold of me. Other than that, I'll see you guys on the next video. Take care.